Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. JAK inhibitors. Main mechanism of action of JAK inhibitors is anti-inflammatory. They also have immunomodulatory action. They are also a type of disease-modifying anti-rheumatoid drugs for which it is approved by FDA. How it is going to do its anti-inflammatory action? By reducing pro-inflammatory cytokines. How is this possible? These JAK inhibitors, here you can see clearly it is inhibiting phosphorylation of STAT by JAK, and then STAT phosphorylates and gets into dimerization. These dimers of STAT will go into nucleus and release pro-inflammatory cytokines, interleukin 12, 23, interferon gamma in response to cytokine interferon gamma with the help of cytokine receptor. These tyrosine kinases are these JAK are Janus kinases. Kinase means whichever the enzyme phosphorylates, they are called kinases. These are non-receptor tyrosine kinases. They don't have receptor activity, so they rely on cytokine receptor. This will do receptor activity and gets attached to cytokines. In response to that, JAK will undergo STAT phosphorylation. This pathway is called JAK-STAT pathway. So JAK inhibitors are also called as JAK-STAT pathway inhibitors, ultimately leading to anti-inflammatory effect by blocking phosphorylation of STAT and STAT activation at the level of JAK. That's why these are called JAK inhibitors. It is classified into two generations. First generation is non-selective. Here you can see it is inhibiting both JAK1 and 3. That is Tofacitinib, which belongs to first generation non-selective JAK inhibitor. FDA approved for rheumatoid arthritis, I already told. Then psoriatic arthritis, ulcerative colitis. Remaining drugs under the same class are Baricitinib, Ruxolitinib. These two similar action inhibiting JAK1 to. Coming to second generation, these are selective. Here you can see selectively inhibiting JAK1. Example, Upadacitinib, Abrocitinib. Both are FDA approved for atopic dermatitis. Coming to off-label uses of Tofacitinib, atopic dermatitis, actinic dermatitis, alopecia areata. Next, connective tissue disease, dermatomyositis, systemic sclerosis, SLE, cutaneous T-cell lymphoma. Coming to its pharmacology, 2% ointment, oral solution, mainly tablets, 5 mg, 10 mg dosages are available. It has good oral absorption, bioavailability with 70%, reaches peak in short time 30 minutes, and T-half is also short 3 hours. Metabolized in liver by enzyme CYP3A4 into inactive metabolite. Once metabolized, it will become inactive. It is pregnancy category C. That is, has risk found in animals, no human studies. It is absolutely contraindicated in pregnancy, Tofacitinib, and also hypersensitivity for every drug, absolute contraindication. Coming to its adverse effects, infections. Any immunosuppressor will lead to opportunistic infections, reactivation of TB, herpes, mainly upper respiratory tract infection. So we have to test for any active infection of TB, latent TB, hepatitis B, hepatitis C prior starting this Tofacitinib. Next adverse effect, malignancy. Most common non-melanoma skin cancer. Melanomas, solid organ and lymphomas can also occur. Epstein-Barr virus associated lymphomas. Mainly in post-transplant patients where we will give other immunosuppressants also along with Tofacitinib, increasing further risk of malignancies. Hematological abnormality, lymphocytopenia. So if total lymphocyte count is less than 500 cells per mm cube, stop the drug. Neutropenia, same, absolute neutrophil count less than 500, stop the drug. Anemia, hemoglobin of less than 9, stop the drug. Before starting the drug itself, these derangements are there, don't start the drug. It will further derange. dyspnea because pulmonary embolism, edema, COPD, interstitial lung disease, it will affect lungs also. Metabolic derangement like increased total cholesterol, triglycerides and LDL. So we have to test for lipid profile and monitor also. GI adverse effect perforation, liver enzyme derangements. So we have to monitor LFT. It is eliminated unchanged 30% in urine. So we have to monitor RFTs also, monitor LFT, RFT. These are all comes under relative contraindications also, infections. So while on tofacitinib, patient will be immunosuppressed. So we have to avoid any live vaccines. Remember the channel name, The Average Dermadoc. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Das vidania.